All right, today we are diving deep into something called complex regional pain syndrome, or CRPS. And this is so much more than just a medical file or a diagnosis. It's really about a journey that can reshape pretty much every part of a person's life. So let's get into it. This quote really just says it all, doesn't it? It perfectly captures this two-sided reality of living with CRPS. On one hand, you've got these immense challenges, but on the other, you find these incredible moments of hope and just pure strength. So to really wrap our heads around this journey, we have to start with the pain itself. Because with CRPS, what you feel physically is tangled up so tightly with what's going on in your mind. They're almost impossible to separate. So what is CRPS exactly? Well, imagine you have a pretty minor injury, like a sprained wrist or maybe a small surgery. But instead of getting better, the pain it explodes. It turns into this persistent, severe, often burning pain that is way, way out of proportion to what happened. And it often brings friends like swelling, a wild sensitivity to touch, and even the color and temperature of your skin can change. And that leads us to the critical question, right? When your body is screaming at you with these nonstop, intense pain signals, what does that actually do to your mind, to your emotions? Well, it creates what a lot of experts call a vicious cycle. It's a nasty feedback loop. The physical pain, naturally, causes a ton of stress, anxiety, sometimes deep depression. But here's the kicker. That psychological distress then turns around and actually makes the brain perceive the pain as being even worse. The two get locked in this terrible dance where each one fuels the other. And a cycle like that, it doesn't stay contained. It sends ripples outward. And those ripples hit the biggest pillars of our lives, our work and our family. Think about it. For so many of us, our career is a huge part of our identity. But CRPS can just throw a wrench in everything. Simple things we never thought twice about. Lifting something, typing, just being on your feet can suddenly feel like climbing a mountain. But there are things that can be done. This is a look at some practical initial accommodations, and the source material lays out some clear starting points. For an upper limb issue, maybe a lifting limit of just 5 pounds and avoiding repetitive tasks. For the lower body, maybe a 10-pound limit, and making sure you can switch between sitting and standing. These aren't huge, complicated changes, but they can be a total game changer for staying at work. And this is where a team approach is just absolutely essential. But with one really important rule: the patient is the captain of their own ship. They're in charge. Now, the crew has the usual vital members, your doctor, your therapist, but look who's highlighted here, the vocational counselor. This is the person who can be a crucial navigator for all those workplace challenges, helping to connect your medical needs with your professional life. Okay, now let's shift gears and talk about family. This quote, it's just so powerful because it shines a huge spotlight on the caregivers, who so often become these hidden patients. They're carrying this massive emotional weight, and a lot of the time, nobody even sees it. And that's exactly why you'll often hear CRPS called a family disease. It's not happening in a vacuum. It completely reshuffles the deck. A partner might suddenly become a full-time caregiver. A parent might have to rely on their child for help. These shifts put an unbelievable amount of stress on the entire family. So supporting the family becomes just as critical as treating the patient. So this all leads to a really important turning point in this whole journey, and that's empowerment. A huge part of feeling empowered is consciously going out and building a support system, one that goes beyond just your immediate family. Now, support can look different for different people, and that's okay. Each type has its own superpower. In-person groups, they give you that direct human connection, that feeling of literally being in a room with people who get it. But online communities offer something else just as valuable. They're there for you 24/7, and they give you a layer of anonymity that can make it so much easier to talk about the really tough stuff. And the benefits of finding your community are just profound. First, it shatters that feeling of isolation that chronic pain builds around you. It gives you validation. I mean, hearing someone say, "I get it," and knowing they really get it, that's priceless. But it's more than just talk. It's about sharing real strategies that work. And maybe most importantly, it helps you start to rebuild a sense of who you are beyond the pain. Okay, let's get super practical because living well with CRPS means you need a daily management toolkit, a collection of real, hands-on strategies and resources that help you take back some control, one day at a time. The foundation of this toolkit is all about lifestyle. Things like shifting to an anti-inflammatory diet with foods like turmeric or ginger to help calm your body's systems down, making good sleep a top non-negotiable priority. Learning the art of pacing, which is really just about breaking your day into smaller chunks to save your energy. And of course, getting rid of things that actively fight against you, like smoking. Your home can actually become part of your therapy. As you can see here, some simple changes can make a massive difference. Grab bars and a shower chair in the bathroom for safety and confidence. A little bed cradle that keeps the weight of the blankets off of sensitive skin. Ergonomic tools in the kitchen. These aren't just about convenience. They're tools that give you back your independence. And that idea of using tools leads us right into assistive technology. These devices are awesome because they do two things at once. Yeah, they help you with physical tasks, but just as importantly, they help you manage your most valuable resource, which is your energy. And the range of tools out there is pretty amazing. For getting around, you've got everything from a simple cane to these really cool rollators that can even turn into a chair when you need a break. For getting dressed, there are button hooks and zipper pulls. For the kitchen, adaptive knives, special openers, and don't sleep on modern tech. Voice-activated smart speakers and ergonomic mice can cut down on so much physical strain. But let's be real for a second. Even with all of the best tools and plans, flare-ups are going to happen. They can feel like they come out of nowhere, and honestly, they can be really overwhelming. But being ready for them, having a clear plan, that is the key to getting through them without panic setting in. So think of this as your emergency flare-up plan, a simple 4-step toolkit. Step 1, rest and breathe. The goal is to calm your nervous system down. Deep breathing, meditation, whatever works for you. Step 2, gentle touch. Gentle massage or stretching sends new, non-painful signals to your brain. Step 3, apply and stimulate. Use things like topical creams or a TENS unit to disrupt the pain signals. And finally, step 4, distract. Get your brain to focus on something else entirely. A game, a movie, a great conversation. It's a clear path to follow when you feel like you're lost in the pain. So, after all of this, what's the one big takeaway? The single most important thing to remember? It's that living well with CRPS is all about taking a holistic approach. At the end of the day, this journey is complicated. It's multi-layered. There's no one magic pill. But you are not just a passenger along for the ride. You are the captain. You are in charge, and you have this powerful toolkit of strategies from your medical care to your lifestyle to your support system that lets you actively shape your own recovery and your own well-being. And this leaves us with one final, bigger question. We've talked a lot about the personal toolkit, but what about the world around us? How can we, as a society, as a community, get better at really seeing, understanding, and supporting people who are on an invisible journey like this one? That's a question for all of us to think about. Thanks for tuning in.